that require the breaks to be paid, but those are few and far between. So lost wages are a big part of a big issue with nursing breaks in the United States anyway. And then there's no provision for feeding the child. So it's all about pumping breaks. There's no necessarily having like the child come to the workplace and being able to feed the child there, as opposed to just pump the milk, excuse me. And then there's also the provision just says express milk for her nursing child. So there's not necessarily any provision that protects those who might be expressing milk for other reasons, simply like maybe they're wanting to donate breast milk after the loss of a child, or they have had a surrogacy or something like that, and so are expressing breast milk in that time. And so the individuals may not be protected in that way. Next, please. In Mississippi, there are additional protections. So under the nursing mothers law here in Mississippi, the time is unlimited. So they can take pumping breaks past 1 year. It's only federally mandated for 1 year. It's unlimited here in Mississippi. So as long as somebody is breastfeeding, they are eligible to take breaks to express breast milk. Child care facilities are required to provide breastfeeding mothers, including its employees, but also the mothers of the children who reside in the or are taken care of within the child care facility, a space other than a bathroom to pump or breastfeed. And it needs to include an outlet and be near a water source. Also, child care workers in Mississippi are supposed to be trained on handling breast milk, and so that children can have be fed breast milk in that child care facility, expressed milk. Also, nursing mothers in Mississippi are exempt from jury duty and indecent exposure laws. So those are some additional protections that Mississippi provides. Next, please. However, in Mississippi, they designate that employers cannot prevent an employee from expressing breast milk during a pre-existing break or meal period. So they are there, and again, here are some loopholes that exist, because they're supposed to use the pre-existing breaks and meal periods as pumping breaks, but Mississippi at the same time does not have a required meal or break law. So there's some wiggle room in there for people. Next, please. There's a lot of difficulty in enforcing these violations too. So an individual who feels that they have been violated according to the provisions of the nursing mothers work law, those are to be reported to the Department of Labor's Wage and Hour Division. But generally, the penalty for violation of those things is to compensate the employee for lost wages. That's the typical penalty. But because breaks are unpaid, there's really no penalty that exists for organizations and companies and places of business, places of workplaces, so that those are really enforced fully. Next, please. But right now, currently in committee, there's the Mississippi Pregnant Workers Fairness Act, and it would clear up some of these issues. So it would prohibit discrimination in employment based on pregnancy, childbirth, or a related condition. And related condition then is nursing or breastfeeding. And they also want to provide definitions for terms. So what are reasonable accommodations? What does that mean? What kind of accommodations need to be created for the nursing mother? What are related conditions and what are undue hardships? So some of these things would clear up some of the vaguer terms that then allow for less enforcement. They would also require an employee to provide written notice of the right to be free from discrimination in relation to pregnancy, childbirth, and related conditions. So this would need to be given to the individual upon employment. And then it would also create an actionable right for any employee who believes his or her rights have been violated. So something other than just reporting it to the hourly wage department. So I realize I breezed through that, but I want to give more time to Cathy, because she has some, I think, more upbeat things to share with us. So I'm open to questions at the end, but for now, Cathy, please take over.
Great. Thank you so much, Tess, for that super overview of the laws here in Mississippi. For my part of the webinar, I'm going to drill down just a little more into some workplace initiatives, and particularly here in Mississippi, some things that we're going to be launching. I do want to let you all know that I have a handout that provides all of the URLs that I'm going to be showing. I've got quite a few slides with a number of website URLs and resources and references. If you're interested in receiving that handout, if you would just go to the chat box, go down to the bottom of the screen and click on chat and type in your email address into the chat box, and the CHAMPS staff will be happy to send that to you. So thank you for that. I hope everyone will get a hold of that because there's a lot of great resources in there. Before I get started, I just have to say something about this adorable little girl on this slide. This is my youngest granddaughter. She will be a year old next week, and she is still fully breastfeeding, as you can tell by those thighs. But what I really wanted to point out was the outfit she is wearing. My daughter-in-law managed to find this fabric somewhere, and she had a seamstress sew this outfit, and then they did a photo shoot with her wearing it.
I cannot believe that, Cathy. That is the most hilarious outfit I've ever seen.
Isn't it darling? So for Christmas, they gave me this picture blown up in a canvas. So it hangs in my office now. And I have to say it was the best Christmas present ever. But she is just doing really well. Next slide, please. I have a couple of disclosures. I have been at work with the federal government on a number of national initiatives, including the HHS Maternal and Child Health Bureau, where we developed the business case for breastfeeding, as well as the HHS Office on Women's Health. And we did an initiative for them called Supporting Nursing Moms at Work. Those were paid contracts, and I do still teach on all of the things we learned as a part of that amazing process. I do also work in a number of state contracts working on work site issues. So go ahead and go to the next slide, Aisha. As we begin, I just wanted to acknowledge, I was looking at all the names of people who are participating today, and some of you, I can see a lot of WIC people, I see some hospital people as well as others. And I wanted to acknowledge that sometimes when we are thinking about workplace issues, we get a little bit of tunnel vision and we begin to think, well, you know, this is my role, this is my job, and I don't know where workplace support fits with what I'm doing. But I'm a real big believer that workplace support is something that all of us can be working on within our various roles. So for example, if your role is to work directly with mothers and babies, then it's important that you be able to share resources with moms and even help them have a conversation with their supervisor so that they kind of know how to have that conversation. Some of you may be in a position to be able to address your own institution's policies and practices regarding breastfeeding support for employees, not just for patients and clients. Some of you may be in a position where you could actually do some outreach with some of the workplaces in your community. So I just feel like all of us have a role to play, and it is truly needed. So we guys would go to the next slide. I'll give just a little bit of background. Millennials today, which are the group ages 23 to 38, currently make up the largest segment of the workforce today, which is pretty amazing because the baby boomers have been the large segment for many, many years, but now that has been changed. So what that means is that mothers with children are an increasingly important focus group of that workplace. In fact, according to the DOL, today women with children are the fastest growing segment of the workforce. So people who think that mothers don't go back to work after babies are born are mistaken. Women are going back in ever increasing numbers. And what we've learned from the research is that about half of new mothers say their work plans affected the decisions that they were going to make about feeding their baby. In fact, if you work in a hospital, you may have heard many mothers say, I'm going to do both. And sometimes the reason they say they're going to do both is because they're going back to work and they don't realize that they don't, you know, they can just exclusively breastfeed and continue to breastfeed when they go back to work. Now, this is a special concern because 23%, nearly 1 in 4 mothers, return to work within 2 weeks after giving birth. So workplace support has to be a part of the support we're providing mothers if we want to increase our exclusive breastfeeding rates. So on the next slide, I just want to remind us that there's a special concern of women who work in low-wage jobs. You know, people who are working in a low-wage workforce often do not have the autonomy to set their own schedule to accommodate nursing breaks. And they may find that space is really hard to find if they're not working in an office setting. We also know from research that African American and Latino women are overrepresented in the low wage segment of the workforce. And we know that Black women are less likely to take a longer or adequate maternity leave, and they on average return to work about 2 weeks sooner than parents in other population groups. Next slide, please. So there's an organization called the Center for American Progress, and it's a bipartisan nonprofit organization. They collect data every year on what they call the status of women in the United States, and they break down that data by state. So I took a look at Mississippi's data, and according to the Center for American Progress, Mississippi has had almost no improvement in our employment disparities in the last 15 years. So for example, they report that Black women make on average around $10,000 less a year than Caucasian women. And in terms of that gender disparity gap, they only make 56 cents for every dollar that a white man makes. The national average for women is 81 cents. And even here in Mississippi, the average among Caucasian women is 75 cents. So now what does this have to do with breastfeeding? You might be asking yourself. Well, it means that Black women here in Mississippi in particular are more likely to be working in low-wage jobs. They're more likely to be working in a job that doesn't pay enough to meet their needs. And that often means women are working in more than one job and trying to juggle the demands of employment and sustaining lactation. And they may not be in the type of position where they feel that they can speak up about their needs. Next slide. So that's a big deal because while the breastfeeding initiation rates continue to rise nationwide and even here in Mississippi, thanks to the incredibly hard work of all of our hospitals here in the state, we see that our exclusivity rates and our duration rates dramatically decline once the mother leaves the hospital. Now, the blue bar in this graph shows the breastfeeding rate of the general population. The pink bar represents the rates nationally for African Americans, and the green bar represents WIC parents in the low-income community. And we know that returning to work is a significant reason that women stop breastfeeding. One study that was reported in a business journal found that when breastfeeding women return to work, over 80% of them have stopped breastfeeding by the time they finish their first month back at work. So I'm going to ask us to bring up a poll on the next slide and just ask you, why do you think this is? You have an opportunity to click on 2 reasons of why you think mothers may discontinue breastfeeding or what they might value most. What do they need to be able to continue breastfeeding? I've got a lot of options here. So if you would go ahead and pick the 2 that you feel employed parents value the most. And we'll give you just a second to allow people to fill that out. And as you're doing that, I will tell you that the research will show that all of these are a factor for sure, but there are 2 that kind of rose to the top in some of the studies that we have looked at. So after you click on the 2 you want, hit the submit button and if we can see the results, Aisha, are you able to display? Here we go. All right, so it looks like the most of you feel like having a private place to express milk, supportive supervisor, paid maternity leave, time to express milk. These are all important. Every one of these are important. But the one that seemed to emerge at the very top was having a supportive supervisor. That was number one. Number two was having the time, being able to work that out in the scheduling. And number three was having supportive colleagues. So what we see from that is that many women probably are able to work out the space. The time is a big issue for a lot of women, but having support from the supervisor and from colleagues really matters. So let's go to the next slide. I'm going to talk just a few minutes about some of the barriers that have been identified in the research. As you all have noted already, rigid schedules can make it very hard for women to find the time or the coverage that they need to be away and express milk. The need to have space is a huge issue for mothers, particularly if they're not working in an office environment. It's usually pretty easy to find space in an office area, but much harder when you're in a non-office environment. We do know that many women have a very hard time talking about their needs with their supervisor, especially if that supervisor is a male. But I will tell you, we have heard story after story of women who have said that it was even hard to talk to a female supervisor, especially if the supervisor did not personally breastfeed or was not very supportive. That can be very challenging. Women also worry about the coworkers. Sometimes they think their coworkers won't be supportive, even if the coworkers are going to be supportive. They worry that they're going to put everyone out if they're taking time away and somebody has to cover for them. And they worry that their coworkers are going to make embarrassing comments. I cannot tell you how many women I have talked to who have said that coworkers would walk by the lactation room and moo as they went past that room. And I've heard some just horrific stories that have come to the top. So women worry about these things. Now, you also should know that most women are not aware that they have federal and state rights. We did a series of focus groups all over the state of New York in rural and urban communities. And we found that even though New York had had a state law, very strong state law for nearly 10 years, and there was a federal law, almost none of these, and these were low-income women, almost none of them knew that they had any rights. They felt like they had to figure this all out by themselves. And they also said, every one of them said, if I had known that I had legal rights, I would have at least tried. I would have at least made a different choice at the beginning. So let's go to the next slide. This is a big deal. And I think that tells all of us who work with new families that we need to let them know they have rights and where to get the resources for support. We also want to just mention that women and parents working in low-wage job settings have even more barriers. Here in Mississippi, over a third of employed women work in low-wage jobs. And these jobs aren't easy. These are jobs that have people standing on their feet for long hours. They often are fatigued more. They may already have health concerns, and chronic stress can be very, very difficult. They also tend to work non-standard hours, which means they're going to rely more on their family members to take care of their children. In fact, some studies are showing that around 30 to 40% of babies in this country are cared for by grandparents, not in formal child care centers. So the concerns that moms have are real, and that's why we need to look at ways to address some of these disparities. So on the next slide, you're going to see some examples of the kinds of businesses that women work at here in Mississippi. And here in our state, the primary industries tend to be restaurants, chicken plants, retail stores, hospitals, and schools and universities. Now, obviously, where the biggest employer is going to kind of depend on what area of the state that a woman lives in. But in general, the top employer in nearly every region of the state tends to be hospitals. And that's not surprising when you realize that in rural communities, hospitals are invariably the largest employers in communities. In fact, our largest employer in the state of Mississippi is UMMC, University of Mississippi Medical Center. Our second largest industry tends to be schools and universities. Walmart tends to come in third. We have about 22,000 employees in 85 stores across the state. And then the poultry industry is also way up there. Mississippi is the 5th largest poultry producer in the United States. They employ about 30,000 people across the state, and many of them are women, and over half of these women represent minority groups. Next slide, please. So one of the chief requests that mothers tend to make of us is to be their voice, to advocate for them. You know, you may never know the stories of some of the women and what they really have to deal with. Some of you may be in a position that you are able to hear those stories. But when you know those stories and you know how these mothers are struggling to deal with issues at work, and we can in turn respond by being an advocate for them, it can make a profound impact and just improving the overall environment for support. Now, this is one of my favorite pictures here. This is a picture of 2 women, young women. They are breastfeeding moms who work in a Goodwill store in Indianapolis. And the man standing in the middle of them is their supervisor. What's interesting, I was up in Indiana. We were working on the Office on Women's Health project, and we actually did a video of these 2 mothers and their supervisor. And one of the things we learned when I did the interviews is that both of these women had not planned to breastfeed. They had not planned to, even though they thought they might want to, because they couldn't figure out how they would ever make it work once they went back to work. But they were in for a surprise, because when they told their supervisor that they were pregnant, this young man told both of them at separate times. He said, you know what, we're going to accommodate any of the needs you have while you're pregnant. I want you to know that. And then he went on and said, if you decide to breastfeed when you come back to work, we're going to support you with that. And both of these women said because he brought the subject up, they felt confident that they would be able to go ahead and breastfeed. And both of these women had breastfed over a year. When the time we did this video, they were both still breastfeeding and still going strong. Next slide, please. You know, I would love it if every employer in Mississippi and in the United States would take that kind of attitude. And the good news is we've now learned quite a bit about what it takes to get employers on our team. I have worked with literally thousands of employers and mothers all across the country. I've worked with all of the major national business organizations. And one of the key things I've learned is that for the most part, most employers do care about their employees and they do want to meet their needs. There's just a few that are, you know, not very supportive, but overall, most of them really do value their employees. They do, however, not know how to make breastfeeding work. They are pretty clueless about the breastfeeding rates, about what a mother might need, and about how they're going to work this into their workplace. We've also learned that employers are motivated by knowing the law. So all the things that Tess talked about, that is important for us to make sure employers know about that. But you have to be careful. You can't go in and say, do you know here in Mississippi, it is the law, you have to support women with breastfeeding, because if you go in with that approach, they feel very easily threatened and become very defensive. So I have found that the way I approach businesses is I usually say, you know, we know it's hard to keep up with all of the requirements. You've got a lot you've got to keep up with. We're here to help make that easier for you and to help you find some solutions. And I found businesses really appreciate that approach. They really appreciate knowing that somebody is there to give them some help. We also have found businesses do not know that there are bottom line benefits for them. We don't have time in this short amount of the webinar to really go through all of this content. Some of that will be made available to you at a later time. But let's move on to the next slide, because we have learned that among employers, one of their primary barriers is lack of space. We know that they're not very knowledgeable, but if their perspective is, I don't know where I'm going to do this. I have no idea how I'm going to do this. And we have identified hundreds and hundreds of solutions that can work in virtually every kind of industry. Everything from converting storage rooms, little closets, flexible space such as conference rooms or employee break rooms, dressing rooms in retail stores. Many companies have told us that it was just easier to tell the women to bring the baby to work in some environments. That won't work in a busy hospital emergency room in some places, but in some types of settings that can actually work. Many hospitals and other large companies have found that multi-user spaces can help them meet the needs of a larger population needing space. And we've also found from both the National Restaurant Association as well as from local restaurants that being able to stagger an employee's schedules really makes it easier for them to provide support. This picture in the bottom right is a picture of a manager of a Carl's Jr. in Sacramento, California. And she told us that they had 7 women on her staff that were breastfeeding, and she was able to support all of them. They used a storage room in the back of the restaurant, and she just learned to stagger the schedule. She said it's really not that hard once you, really sit down and look at it. So the next slide, please. The U.S. Department of Labor tells us that in terms of what needs to be in the space, it needs to be functional for milk expression. So whether it's a flexible space or a dedicated room, that space needs to include a comfortable chair, something to put the pump on, and ideally an electrical outlet. And I do recommend that hospitals and any business, if they're first starting out, that they try to purchase a chair that can be wiped clean. That's especially important during this pandemic, I think. And being able to secure the space is going to be important. We want moms to feel safe. We want them to feel people are not going to be barging in on them. And this particular room, this is a room in a hospital in Atlanta, Georgia. And I happen to know that there's a keypad lock on the outside of this door. And once mothers get inside, they can lock their little space within. So that's certainly a great benefit for them. Not every space is going to be able to do that, but I think if we can look for ways to allow that mother to feel she has control over her own safety, that's always a good thing. Next slide. So in working with hospitals, we have found that often one of the biggest issues for nurses is patient coverage. And many of the hospitals that I have worked with across the country have said that they usually use their nurse manager to provide patient coverage when a nurse needs to express milk. I think that's important that we need to have the whole team on this because if you just leave it up to the nurse to figure it out, she's going to feel like I can't make this work. So it is important for nurse managers and HR to be working together to find solutions to make that work. In a lot of hospitals, they find milk expression areas by either converting a patient room, maybe an exam room, using storage areas that can serve dual purposes, or even scheduling use of a patient consult room. So there are ways to work around that. If you work at a hospital, I'm going to challenge you to learn what you can about the HR policies in your facility. What does it say? What kinds of provisions does it provide? Does the policy align with both federal law and your state law? And is space available to all employees, not just to the ones who work in the mother-baby unit? How is patient coverage going to be provided? And I'm also going to challenge you to speak up to the mothers that you serve after they deliver. Find out where they're going to be working. Find out what resources that they have and what they've thought about, and point them to sources of support. Now, if we'll go to the next slide, I'm just going to mention a couple of great stories of a couple of businesses that we worked with. One was a strawberry farm in California. This was a firm that employs about 23,000 people, many of them women. And as you can see, working in a big agricultural field, there's nothing. There was absolutely nothing for these women to be able to enjoy some privacy. So on the next slide, we'll see what this particular company did. They actually purchased Popup tents, which are very lightweight. They're breathable. They've got some air vents at the top, and they fold down very easily. They're very lightweight. They cost about $75 or so. So they purchased a whole slew of these tents, and the mothers can put those up near their workstation. Moms use a personal cooler that they include ice packs so that they can store their milk until they can get to a location to refrigerate their milk. And on the next slide, you'll see their next option that they came up with. They allow the women to actually park their car right near their workstation. And if the women do not have a car, they're allowed to use a company vehicle parked near their workstation. And the local WIC program provided privacy visors, so the moms are able to provide some privacy while they're pumping. I just thought that was just a great solution. And again, I think in every industry, we've identified so many solutions. There's no excuse for a business to say, there's no way we can make this work. Next slide. My very favorite story involved an Army military base in Tacoma, Washington. I did an interview with the director of this program. And what she told me was that the Army has a pretty good maternity leave policy now, so women are able to take some time, but many of their women are still breastfeeding after their leave is up. So what they do is if a mother's going to be deployed following their maternity leave, they give them a good quality electric breast pump. That's just something that they provide to them, and the mother's able to take that with them overseas. Now look at the next slide, and you'll see how they made that work. They're able to use the generator and tents in the fields to power their pump. And what do they do with the milk? Well, guess what? The Army provides for the milk to be shipped back to their home using FedEx planes and Army transport planes. Now, when I interviewed this director, she told me, these are her words, you tell employers out there that if the Army can figure this out, anyone can. Next slide. So with that in mind, the CHAMPS is soon going to be launching a workplace initiative with funds from the W.K. Kellogg Foundation right here in Mississippi. And our goal will be to address some of the challenges that breastfeeding mothers face in the work environment here in our state. I'll be heading up this initiative. I'm really, really excited about the opportunity to make a difference for working moms right here in our state. We're still working out some of the specific details, so I can't give you a very complete list of everything that we're going to be doing. But we do expect that the project will include engaging with hospitals as employers here in the state in targeted areas. We also will be expecting to conduct some webinar training for breastfeeding advocates. We'll focus hopefully on supporting working mothers, as well as doing outreach with employers. And we're also expecting to develop a Mississippi-specific toolkit of resources for employees, as well as for HR managers and supervisors here in the state. We're also planning to partner with various groups to just heighten awareness of the issues that breastfeeding moms here in Mississippi face. Next slide. So in the meantime, I want to point you to just a few of the great resources that are already available. Tess talked a lot about all of the federal laws, and I wanted to just mention the U.S. Department of Labor website. I will tell you, if you try to go to the main site and try to hunt for this page, you're probably going to get frustrated because their website is pretty convoluted. It's very hard to navigate. I typically go do a search for nursing breaks law, DOL, and it always comes right up, but I did provide the direct link in the handout. This has exact language of the law and a lot of links for support and resources. And there's also a great fact sheet you might want to print off and make available to moms as well as to their employers. It's called fact sheet number 73, and it gives lots of great detail about the requirements. Next slide. The HHS Office on Women's Health also has a great array of resources that we have developed as part of the national initiative with them. This includes a YouTube breastfeeding channel. They have 29 videos representing all of the major industries in the United States. And I'm really proud of those videos. These can be downloaded and shared with moms or with employers, and they really provide solutions for how to make it work in various industries. Next slide. I also wanted to mention the New York Breastfeeding Partners website. You can download these materials. This is called the Making It Work Toolkit that we developed following statewide research that we conducted with employers and with new moms. Several of those pieces, although it's very, very New York specific, I think you might find some of this very interesting, particularly the green booklet, which is devoted to family members and how they can support working moms. The yellow brochure is the one for employees. And if we'll go to the next slide, you're going to see my favorite part of this resource. It's called My Lactation and Work Plan. This is sort of like a birth plan for a hospital, only it's a work and breastfeeding plan for business. And it just gives the mother a tool that she can share with her employer. to talk about what our needs are going to be. This has been really a popular part of this toolkit. The next slide mentions another great resource. I'm so happy about the work that A Better Balance is doing. This is a nonprofit organization that works to empower new parents about their breastfeeding and work rights. One of the things I love about this website is a document they have called How to Talk to Your Boss About Your Pump. And they break this down by the state. So there is a document for every single state that talks about the rights of women in that particular state and how a mother can use that information and knowledge about her rights to have a very positive and productive conversation. So I really urge you to check that out. Next slide is another great resource available from the Center for Work-Life Law, and it's called A Guide for Healthcare Professionals. And this is a great resource that provides step-by-step resources and just things that we can do in the healthcare setting to better support new moms. Next slide, I wanted to mention also the Center for Work-Life Law has a free hotline as well as a free email hotline to provide some legal help. So if you have moms that are having trouble navigating the laws that Tess talked about, this is a great resource for them. Next slide, I wanted to just conclude with just a few thoughts about the CDC guidance during COVID-19. There is some wonderful information on ways that businesses and workplaces can make their workplace safer during the COVID pandemic. Next slide, I want to mention a resource we created as part of a current project I'm working on with the state of Ohio. And this is a document called Considerations for Safe Lactation Spaces. We did this for businesses in Ohio, and you can download that. It's free of charge, along with all the new resources we created for the state of Ohio. But what we did is we took the CDC guidance for workplaces and applied that to milk expression areas. So the next slide, we did talk about the importance of wiping down areas that are commonly touched and used in a workplace, and that includes the lactation room. And I wanted to mention that that CDC guidance document also lists EPA approved products for fighting the COVID virus. So I think that's a really helpful resource as well. The next slide, I wanted to mention that the CDC has some great resources on how to clean your breast pump and the accessory kit. And I've got a link for that, though, you'll see in just a moment. But this guidance does talk about the importance of wiping the outside of the pump, wiping the knobs, the on and off switches, and all the parts that people touch, as well as that workplace surface or the space that the pump is going to be on. So providing sanitary wipes and hand sanitizer in the expression room is going to be really important. Next slide, we want to remind moms to clean their breast pump parts, and it's really advised, rather than putting them in a sink that is used by everybody for everything, that a mom have a separate little dish pan that she keeps her breast pump parts in to clean them with. You can get those at dollar stores for, around $1 or so. So it's a very inexpensive expense. And the next slide has the link to the CDC document on how to keep your breast pump clean. It's available in both English and Spanish, and I urge you all to take a look at that. Next slide, just a quick reminder. The CDC guidance for workplaces had a note in there where they mentioned that it's probably best not to share office space with other people during the pandemic. And I got to thinking about how many people in the breastfeeding world are using offices of coworkers to express milk. So I don't know, it may be something to consider, that maybe during this pandemic, people look for other solutions. Next slide, I want to remind you, if you are in a hospital and you have multi-user spaces like this is a hospital in Washington, D.C., you may want to keep in mind that each individual pumper within that milk expression space needs to be spaced 6 feet apart. And you may want to think about barriers or some kind of protection that will help prevent the spread of the virus as women are pumping. And finally, I wanted to mention the CDC guidance document talks about ventilation, which I think is an important factor thinking about milk expression areas, because a lot of people use these little tiny closets where there is absolutely no ventilation whatsoever. And if you have multiple people using that little space, it may be important to think about other ideas that will make sure that each woman or each parent who is expressing milk is going to be safe. So the final slide has my email address here. This was just a very quick overview snapshot of just a few key things to be considering. But we're going to be sharing more as we begin our work in this arena here in Mississippi. And if you're interested in being a part of this work, we would definitely love to hear from you. So I'm going to turn it back over to Aisha now to begin our questions and answers. Thank you.
Thank you so much for those wonderful presentations. I definitely personally learned a lot. Really interesting to see all the different ways, different solutions that people have come up with, and the room for creativity that they've kind of expressed in there. So for anyone who has questions for our presenters, please put them in the chat box, or feel free to unmute yourself if you have any question that you would like to ask. And also, please don't forget to put your email in the chat box if you would like to receive the handout that Cathy spoke about during her presentation. Yeah, so please feel free to ask your questions now, and we will take them.
And while we're waiting, I saw a question in the chat box from Vicki Walters asking if that baby was their baby. Yes, indeed, this was a baby delivered at your hospital. Thanks, Vicki, for pointing that out. You guys gave her a great start in life for sure.
Hey, Cathy, that was a fantastic presentation. Thank you so much. I guess I have one question. I'm interested to, I know you said you didn't have a lot of time to get to the research and everything about workplace, but I'm curious, like, have you, or I don't want to put you on the spot, but any of the government organizations that you've worked with, have they ever, like, have they assessed pre and post, you know, when you put in a workplace program and then you see what happens? I'm just wondering if, like, in many cases it's responding to sort of individual needs of people, and I think actually that's something else you can perhaps elaborate on, because I do think, if I'm correct, that like small businesses, you know, they don't need a permanent space. If an employee gets pregnant and then is breastfeeding, they can create a space which wants that employee, and if they've got 3 or 4 people there and they only have 1 pregnancy every 5 years, they don't have to keep a space all that time. I think that's true, right? But I am curious, like some of these bigger places like, you know, Walmart and that, does anyone look at their outcome data if you implement programs and then you see people increasing? Do you know? I'm just curious.
I'm not aware of any evaluations of programs offhand. I know that Brenda Bandy is on the call. I think they might have done some pre and post. I know you all do a state survey with your businesses in Kansas. So Brenda, you might be able to speak to that. I will say, just to confirm, you are correct. A business is not required to have a dedicated room. They are required to accommodate the mother, so that may be a flexible option. A few businesses have done a little bit of data to see how effective the space was in terms of retention, and they have found that they were able to retain employees more easily, but most businesses do not collect that kind of data, unfortunately. I would love to see that be included for sure.
Yeah. This is Brenda in Kansas, and we do an employer survey, but unfortunately we do not ask about the employee outcomes. Most employers aren't tying those two things together, you know, reduced absenteeism and the retention rate. So that's really difficult data to get, I find. So yeah, but thanks for asking. Great question.
Anyone else got any questions? I want to share a story from Kentucky. When I was doing a presentation in Kentucky, and this was a small town in the Appalachia. It's Appalachia, right? Yeah. Sorry, my US geography still lags. Anyway, it was these very, very remote mountains in Kentucky that took me a really long time to get there. And there was a great workplace initiative presentation there from a gentleman who's sort of been, everybody there has been there forever. And he owned this big company, and none of his employees were getting healthcare, basically. I mean, he was looking at all these terrible rates of, you know, obesity and smoking and all the associated morbidity that was going with that in the workforce. And you know, this guy just he just built, and he found out that most of them didn't have a primary care provider at all. So he built a clinic in the parking lot. He built a clinic in the parking lot, and everyone had to walk past, and the only walking that the employees did was like from their cars to the building, so they had to walk past it because they all drove to work. And he did keep really great data, and he found that like his employee sickness days and everything went down because he actually installed primary care providers in the clinic. He had people sign up, you know, for healthcare through them. He gave them actual cash. Like if people stopped smoking or enrolled in a stop smoking program, they would like get money in their paycheck.
Wow.
And he was in it for the, you know, I'm sure he was a nice guy, but he was in it for the business reward. And he found that his employees were just taking far less sick days. He was having to pay out far less compensation, et cetera, et cetera. So, you know, and it was a very sort of conservative area of Kentucky, and yet this was a very brilliant business model. And I thought it was a different way of looking at it from what we sometimes look at in healthcare. But it was amazing. I mean, he had great results, and he was just like this ordinary local businessman, and he just took this on, and it was really fun to listen to his presentation.
That is an awesome story. And I will say there's plenty of data out there showing that businesses do enjoy a positive ROI or return on investment when they do support lactating women. So they have lower rates of absenteeism, they have lower rates of turnover. So when those women leave to have a baby, they are more likely to come back to work. There's so many things, lower healthcare costs. So there's plenty of return on investment for the employer. And we do have research to back that up. Which, you know, I use that all the time when I talk to businesses. This isn't just about the law, and it's not just about doing the right thing, but you actually are going to get some benefits out of this in the long run.
Yeah, and it's good to see it through that lens. I mean, you know, my first question was, do people breastfeed more? But all of those other things are very important. So even if we don't have data on the breastfeeding, it may not even matter. That's kind of what we breastfeeding people always ask. But that may not be the question that people in that field are asking.
No, we tend to approach this through the healthcare lens. And when you speak with a business, you have to talk their language, have a whole different language that you have to use when you're talking to businesses. And that's part of what we're going to talk about in the webinars the training that we'll be providing later on. Great comments.
All right. Thank you so much, everyone, for joining us. Please don't forget to tune in on March 10th for the next webinar, which will focus on community breastfeeding support, the latest from Mississippi. And be on the lookout for registration information, which will launch soon, hopefully tomorrow, about like our upcoming March 19th virtual conference. Thanks again for joining us. We hope you all have a wonderful rest of your week.
Thanks, everyone.
May 19th, not March 19th.
Oh, sorry, May 19th.
Okay. All right. Thanks, everybody. Bye-bye.